You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Kentucky's go-to implant dentist, Dr. Ryan Wayland. Dr. Wayland, welcome to the program.
Thank you very much, Randy.
Now, before we get into today's topic, for people that don't know your practice, because you're a prosthodontist, but who's the typical dental implant patient?
Randy, there are a couple of patients. There's a patient that has a really hard time with the denture that they have currently.
Okay.
And there's a lot of ways to describe that patient. They've got a denture when they were really young, they got a denture when they were 40 years old, or they just got a denture and they're 70 years old.
Okay.
But they're frustrated with the absence of teeth. So they come to us so they can get teeth that don't come out of their mouth.
Okay.
The second group of patients are patients who are frustrated with the teeth that they still have.
Okay.
But they know that there's problems. They've been to the dentist 1,000 times, spent thousands of dollars, frustrated by the bleeding gums, bad breath. Somebody's criticized it. Somebody hasn't criticized it, but they know that somebody's noticed their teeth, and they don't like their teeth. And they're ready to punt. They're done with their teeth. They really want out of the frustration.
So what do you do for those people?
It's time for something that's different than dentures, dental implants. They've also been told that they can't save their teeth. And they believe it. They've decided that that is exactly their circumstance. And so they're trying to figure out who to go to and what to do about it.
In Kentucky, are there a lot of people wearing dentures or headed to dentures?
There are thousands of people that don't have teeth in Kentucky. And most of them have sought to replace their teeth with dentures.
You don't like
how
dentures?
How do you quantify this, Randy?
Okay.
You know, if I were to quantify it, it's tens of thousands.
Like in the state of Kentucky, would you say close to 100,000, more than 100,000 people wearing an upper
More than
denture?
100,000. There are enough denture wearers in Kentucky that you could line them up on the Ohio River from Louisville to Cincinnati, or make them stand 6 feet apart.
Okay.
That's tens of thousands.
So lots of people. So if implants are so good, why isn't everybody doing it? Why aren't all these denture wearers and coming in? What's your take?
Well, if you have a denture, you quit on your dentist. You don't want to go to the dentist.
Okay.
You don't feel like you need to go to the dentist any longer. So if you think about somebody that's wearing a denture.
So you don't know your options if you're a denture wearer, is what you're saying.
Yeah, because who did you talk to about it last, right? It wasn't your dentist.
Okay.
All you've done is try and wear these prosthetics, these teeth. You're wearing a denture, and you don't know where to go or what kind of life would be different than that. These denture wearers don't know their options.
Okay.
They don't go to the dentist any longer. They have spent years avoiding the dentist. They got out of their teeth, and now they don't need a dentist. They believe that they truly don't need to go to the dentist. So the point is, if you don't go to the dentist and you're wearing a denture, you don't know that there's a better life,
Okay.
that there's a better way. You have settled for a denture life.
What about the denture wearers? You say they have a lot of fear. That's why they don't come in.
Randy, what do you know about wearing a denture?
Nothing.
And that's the key, right? Is I've got to sit here and explain to you why wearing a denture is so terrible.
Okay.
Why it's so hard. Let me tell you.
I know denture wearers, by the way. They've never complained to me once.
You know,
Not once.
because they don't want to talk about the fact that they don't have any teeth left anymore.
Okay. Well, I'm
Right?
not a dentist, so they're not going to tell me.
Right.
Okay.
And so it is a huge upgrade. If you take somebody that's in a denture and you give them that change in their life, it is spectacular.
So is your take the reason why these denture wearers aren't coming in to get a few implants to lock in a brand new set of teeth is just they hate the dentist because of what they've been through?
Look, it's varied, right? You could hate the dentist. It could have been a phobia of the dentist. It could have been the fact that your teeth were really bad and you just quit early. So there are places, regional in Kentucky and throughout the state, throughout southern Indiana, that having teeth is not a necessity. It's a risk. It's a risk of pain. It's a risk of discomfort. And so the sooner that they can get those teeth out of their head and into a denture, the term in Kentucky is a plate.
Plates.
I need a plate. Get me a plate.
We're
not talking about license plate.
You're here today to say that's the old days. Like now,
that is
those
the
same people that get plates,
that is
to
the
get
old days.
Teeth that don't come in and out of their mouth. Is that right?
Right. So to move to teeth that don't come in and out of their mouth, it hasn't even occurred to them that they could or that they should. They're not connected to dentistry at all. They have left the system, so to speak.
Okay.
And some of them have been out of it for decades. Decades.
So how old can you be to get new teeth with dental implants?
There is no age limit.
Okay.
If you have the ability to walk into the office, you have the opportunity to get dental implants.
What about your oldest patient? What's your oldest patient that you gave a brand new teeth, upper and lower two, supported by dental implants?
93.
93.
93. So I got to tell you this story.
Okay.
All right. I had an oral surgery colleague that gave me a call. And he said, "Hey, Ryan, I just saw the daughter of one of your patients, 90 years old. You just gave her lower teeth on implants." And I said, "Really? Who was it?" And he goes, "How many 90-plus-year-old patients do you have?"
Okay.
And I said, "More than you'd guess." So there is no limit, Randy, to age. If you're healthy, even if you don't think you're healthy, there's no age limit.
So could you tell me about this 90-year-old? So the 90-year-old was wearing a denture when she met you, and you gave her teeth supported by dental implants.
No. She had made it all the way to 90. This woman still had lower teeth, and she needed those teeth removed. They had served her for that long.
Okay.
She wanted to be able to eat. And so she came to me to get those teeth out and to put dental implants in with teeth on them.
So what was she able to eat when it was all done?
She could eat anything she wanted.
Okay.
So as soon as she had teeth sitting on dental implants, she was able to chew anything she wanted.
Do they smile more when they get this? I mean, somebody that was wearing a denture, now they've got new teeth.
Absolutely. Because they come in with teeth that are ragged, that are broken down, that have decay in them, and they walk out of the office with teeth that are arranged in this beautiful arrangement that may have some similarity to what their teeth were before, but are white, properly positioned, healthy looking. Thrilled.
Okay.
Truly thrilled.
So 70, if they're doing it at 90, so 70 is young today. 80 is young to get a new teeth with implants.
Randy, almost all my patients are older than 65.
Okay.
They're 70, 80, or 90 years old. When it comes to age, my favorite circumstance was this woman walks into the office.
Okay.
She is, 5 foot on tiptoes. I'm 1.5 feet taller than she is.
Okay.
She walks into the operatory and she's across the chair. She won't sit in the chair. I look at her and she won't look at me. She won't make eye contact.
Okay.
So I'm trying to engage this woman, going, "Oh no, what have I got here?" My MO is as soon as the patient comes in, they sit in the chair and I raise the chair up. And then I sit down in my chair. And once I'm seated in the chair, I'm at eye level.
Okay.
I'm not towering over her. She won't sit in the chair. So I try to engage her. And the conversation goes to age and value and is it worth doing because you're over 90? And she hasn't looked at me. And she looks at me, just stares right at me. and goes, I don't care if I live one more month. I want to eat. So we did it. And she could eat whatever she wanted.
So you gave her brand new upper
She already
teeth?
had dental implant experience because she had implants on the top. But I had to take out all of her lower teeth and give her teeth on the bottom.
Okay.
That she could chew with. If I don't care if I only live another month. I want to eat.
At your office, and your focus, your goal is to just do dental implants, to give people new teeth with dental implants. And I guess how it's normally done is you go to one place that does the surgery, another place that does the imaging, another place where they put the teeth on top. You do both parts. Is that why you're able to do it much faster? And you have your own lab.
If you're a patient looking to get dental implants, there are typically two different ways you can go about it. You can go find one place that does everything.
Okay.
Or you can go find a surgeon that'll do the surgery part, and he has somebody that'll do the teeth part.
Okay.
And both of them have employed a lab, and that's the team.
All different places.
All different places.
Okay.
And all of that has to be coordinated. So their staff, the surgeons, has to talk to the dentist, has to communicate with the laboratory, and all of that coordination and back and forth requires an enormous amount of conversation between the staff.
Okay.
And the challenge with that is, as a patient, you call one office and you want scheduled. They say, okay, we can schedule you, but let's check with the other office. And then you don't hear anything.
So it's a hassle.
Yes, you're back and forth, hassle, frustrated. Who has time for that? In my office, you don't have to coordinate. You come in, you sit down, and you visit with me.
Okay.
I make recommendations with the imaging that we've taken, X-ray imaging, photographs, digital impression, no nasty goop in your mouth.
Okay.
And you sit down with me and I tell you exactly what you need.
Okay.
Before you leave, you know when you can schedule it and what we're doing next. I don't have to call anybody. You don't have to call anybody.
So you do
one
So is it
place.
faster because of this approach?
Yeah, it's efficient. It's faster. It's much faster. And it's not that you're trying to rush a patient through this experience. They don't have time.
Okay.
It's frustrating to go to 3 or 4 places.
So no more dentures. Like dentures as we know them now, maybe someday will not exist. They'll all be attached to something.
Dentures as we know them now should no longer exist now.
Okay.
Because if you have a denture, you have to live a life that's mediocrity. You're frustrated. So you can walk away from that. So, Randy, mediocrity to me is that you can't do what you did when you had teeth.
Okay.
You can't laugh. You can't chew. If you laugh, your dentures are going to leap out of your mouth. If you try to chew food, food gets underneath your dentures. If you go out and eat with somebody, you're looking at the menu going, I can't order that. I can't order that.
Did they tell you this?
Oh, yes.
Okay.
Absolutely. And some people are more vocal about it than others.
Okay.
But there are times when they express the desire to just go crunch into something hard. Vegetables, candy.
So with their new teeth, they could do that.
They can.
Like broccoli, vegetables,
Yes.
whatever.
Because dental implants allow you to leave the world of, I can't eat this, I can't eat that.
Okay, good.
And you just get to eat whatever you want.
So what do they like more? What they can eat or how good it looks?
That's a great question. You know, I think that they love the way that it looks. So people will walk in and they will tell me, Doc, I don't care what it looks like.
Okay.
I just want to eat. And then there's a group that'll come in and they'll say, look, My teeth have looked horrible for years. I don't want to look like this anymore.
Okay.
When you take somebody that's either had a bad denture or they have a good denture and can't eat, and you put dental implants underneath that, they now have the ability to chew what they want, to crunch through anything they want, and to be able to eat anything on that menu. They don't have to say, I can't order this steak. Ooh, that has macadamia nuts in it.
Can't eat.
That's going to get underneath my denture. If I bite down on my denture with the peanuts in that pad thai, I'll have to excuse myself to the restroom.
Okay.
To clean it up. I'll have to stop eating. There's a lot of frustration that comes from
So once
having
they get this
prosthetics.
procedure, like an upper and lower set of teeth that don't come out, that's behind them.
It is behind it. Because all of the forces that have been crushing and torturing them in their gums is gone. They get to quit worrying about the pain and the agony of a denture experience. Randy, that's the other side of it. They love the way that it looks. They didn't just get their function. They got a gorgeous appearance. Randy, if there's one thing
Okay.
that we are really good at, is putting teeth in someone's face in the right places.
Okay.
So if you have a denture and you come into the office and you don't like it, I want to know why you don't like it. I may have my opinion about why it doesn't look good, but I want to know why you think it doesn't look good. And so appearance matters to people. They remember what their teeth looked like, and now they're trying to figure out how to get back there. Why does this thing called a denture not look like I used to look?
So now you can design it in a way where it looks real?
Yes. Not only does it look real, but it can reflect what they looked like in the past.
Okay.
I have a gentleman, he came in and one of his teeth was turned. Well, we don't typically set it up that way, right? Well, why would you have crooked teeth? He goes, Doc, just turn it a little bit. Give me a little bit of what I used to have right there. So this can be very custom
Okay.
for you as a patient.
What about gum disease? I mean, if you have bad gums, can you still do this? Can you still get new teeth with implants?
Absolutely. So anytime that you're in a situation where you have bad teeth,
Okay.
you know your teeth are shot, you have the opportunity to get dental implants. There's no disqualifier.
But if you have infected gums, aren't the gums too bad to do this?
Then we clean it up.
Okay.
That's the beauty of this, is you move out of all of the disease and the trouble and the frustration that comes with teeth that have trouble. Maybe you've gone to the periodontist and you've had scaling and root planing. Maybe you've gone to somebody that said, you have pockets. You can't keep these teeth. You have bone around and below those teeth that can host the dental implants. You are a good candidate for dental implants.
So this is one of those things, look, if you don't like your smile, do something about it. Like, is that your message?
Yes, absolutely. So, and you can do something about it. And most people that are in a denture have already given up on doing something about it. And they want out of that.
Do you think you could wipe out dentures in Kentucky?
That would be awesome if I could wipe out dentures.
There's probably not. Look, if there's over 100,000 people with an upper lower denture in Kentucky, if they all figured out how good it was to get their teeth back supported by dental implants, there's not even enough dentists to help them.
No,
Probably.
there's not. And when we talked earlier about how many people are there, the first thought that went through my head is, man, what if they all walked through the door? What would I do?
Couldn't handle it.
They couldn't handle it.
So if a patient goes to your office, maybe they're wearing a denture or their teeth are so bad they need a full mouth of extractions. What are their options when it comes to dental implants?
2 implants. Snaps in.
Okay.
Doesn't scoot or twist around in your mouth any longer. That's a big upgrade.
Okay.
Patients
So
that
no
are-
more adhesive with that.
Correct.
And just snaps in, snaps out.
You're not gluing it down.
Okay.
Yeah. Next level up, a whole arch of teeth. 5 or 6 dental implants, and the teeth are fixed to those implants. Your teeth don't come in and out.
What could they eat with those?
Anything they want. Because it's not going to move. Doesn't twist, doesn't scoot, doesn't go anywhere. Doesn't get anything stuck underneath it.
But the upper denture, that's pretty good, right? Because of the suction that it has.
Upper denture covers your palate, roof of your mouth. You want dental implants in the top as well. The wonderful thing about not having the roof of your mouth covered is that you can taste and feel your food. So it's the most common request. Doc, I can't stand the roof of my mouth covered.
Okay.
Can I have dental implants in the top? Yes, you can have dental implants in the top. And you can have teeth on those dental implants that don't move, don't come out, fixed.
So when it's all said and done, let's say several months later or whatever, and they're coming in for a cleaning maybe, what is their number one thing that they're happy about when it's all done?
That it's done.
Okay.
Right? That it's over. But they're thrilled that they can eat and chew whatever they want.
Okay.
Do you get to eat and chew whatever you want?
I do.
They get to eat and chew whatever they want. They can chew carrots. They can chew candy.
What about popcorn?
They can chew popcorn. They can
So
chew
it's like anything
anything they want. So the glorious thing about dental implants,
all right,
supporting a denture, having teeth on implants, is that you no longer function as a denture patient. You're a free person.
and then they just
To
get
just
them cleaned
live a
like,
normal life.
like a regular, like every 6 months, you just go into the dentist, get them cleaned?
Come in for a cleaning. Quit worrying about your teeth. Start just living your life.
So no more dentures.
Absolutely. No more dentures.
Thing of the past.
They should be a thing of the past. They can be a thing of the past. If you're the kind of person who knows that your teeth are shot,
Okay.
they're done, either because you're frustrated with the way that they look, the way that they feel, or the infection or trouble that you're having with your teeth, or maybe you're just tired of spending money on your teeth, you turn that around as soon as you do dental implants.
Is it like a third set of teeth?
It is your third set of teeth. And it's not a plate. It's not a denture.
So no
It's
more
teeth.
plates.
It's teeth, right? You don't want to live the life of somebody that can't eat and can't chew.
Now this seems very painful, but you use a nurse anesthetist. They're sedated. You say they pretty much feel nothing during the procedure.
They're sedated. They don't feel anything.
Okay.
No pain during the procedure. And the beauty of it is when I'm having a conversation with them the next morning, they're comfortable then.
Okay. What do they take? Like you give them pain meds to go home with?
Yes. The miraculous thing is that they're astoundingly pain-free without those medications. So if you come in and you are determined to do this, you've mustered a lot of courage to do this. And I want you comfortable. I want you to be able to do it and not worry about being in pain.
So is it IV sedation? Is that what they're doing?
IV sedation, and it's IV sedation with post-operative medications that allow you to be pain-free. When it's all done, they don't complain about pain. It is astoundingly comfortable for these patients. They are blown away at how easy that procedure was on them.
I told you, my father, who's 85 years old, had this done. And now he exaggerates about just about everything, but he said, Randy, it didn't hurt at all, like zero, right? And I'm sure he had discomfort. But is that's a common statement that you hear when it's all done?
It is more common. The exception is otherwise. It is very common for a patient to come in and say, Doc, I really appreciate the fact that you prescribed all that pain medication. I only took one.
Now we have to mention this, and we're very short on time, but we get a lot of questions on our website about how much the dental implants cost, things like that. Because dental insurance, even the best dental insurance, only covers a small portion. Medicare, Medicaid doesn't cover it at all. So what's the answer? for the patients that are on budgets?
You come in and we figure out how you can do it. Our goal is for you to be able to do it. And so we have financing options.
Do people do that?
Yes.
Common?
Yes, very common. Every week. They come in and they are asking what they want to have done. And the very next thing is, how do I get it? How do I afford it?
Then you have to have decent credit. Like you're not carrying the loan yourself.
Sure.
You're going to lenders. Right?
Sure.
Okay.
Sure. But that is your option. And it's amazing what people will do to gain that because they know that they want it. They know they want that life.
Is this one of those things when it's all done, they have their upper and lower teeth that don't come out, where they go, I should have done this years ago?
Absolutely. Why did I wait? That's exactly what they're saying. What I could have done this last year. I could have done this 10 years ago. Now, I'm so thankful that I finally cleared this hurdle and came to see you.
Now we're out of time. When you got on the plane, flew here to California for this interview, I'm sure you had something specifically you wanted to get across here. And in is there something we've left out that you want to say?
My desire, heartfelt desire, is for anyone who feels like they're stuck in a circumstance with teeth that they don't like. They don't like what they feel like, or they don't like what they look like. That they can come in and do something about it.
Good.
I love to be able to take care of people. And when they're happy, I'm happy. I know I don't look that happy right now because I'm freaking out.
Okay, yeah.
But
nerve-wracking.
But it is. It's hard. It's hard to be in the glare, right? But I want them to feel like they can meet the public and be happy and be pleased with what they see.
We are out of time. Final message. Somebody watching this, either they have maybe the bleeding gums, bad breath, loose teeth. They're going to lose all their teeth, or they're the person wearing the plate or the denture. What do you say to them? Final message.
Come and see me. Figure out what you can do. Free consult.
Okay, good. I want to thank you for coming in. Good stuff.
Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.